If you're a new mum, you probably don't have time to even think about getting back into shape. We can't all have it like Victoria Beckham, that has her own chef creating her a no-carb, no-sugar diet. So what do women want? Do they want a helping hand from cosmetic surgery to get back into shape?
There are many changes that happen to a woman's body during pregnancy, and these changes obviously affect the body after pregnancy, and it is a big concern for many women. You've got changes in your hormones, there's fat deposition, there are nutrients which we are normally used to absorbing into our body which affect our skin, which are then taken by the baby, and all these changes do have an effect on a woman's body.
Being pregnant, I think my body's going to go through a lot of changes, maybe might get a few eye bags off like sleepless nights and things like that, but things like stretch marks and things like that are going to be a worry.
Having children is obviously a momentous occasion in any woman's life, but it does take its toll on your body. And certainly when I had my children, which was about 12 years ago, there weren't quite so many procedures or lotions or whatever available. It was very much sort of a little bit of oil and, you know, fingers crossed.
There are many things women are concerned about after having a baby, but four of the main things that we tend to see in the clinic are acne. There's been changes in the skin due to the changes in hormones in the body, and quite often this can lead to the increase in oil production within the skin. And for somebody that may have had a previously beautifully clear skin, suddenly they're developing problems with spots. One of the other problems that we do tend to see in the clinic are pigmentation changes. This is a very common problem post-pregnancy and can mainly affect around the mouth area or around the eye area across the cheek. Now, these conditions are called melasma or cloasma, and again, they are caused by the changes of the hormones in the body during the time of pregnancy. But one thing that may not help this is sun exposure on top. Last but not least, one of the biggest, I think, for many women post-pregnancy are stretch marks. Unfortunately, as the body expands, the elastin in the skin becomes stretched. Following the birth of the baby, the skin then may have difficulty in retracting, and hence the development of stretch marks.
Developed stretch marks quite late on during my pregnancy, and wanted to be able to wear a bikini and that kind of thing. So came along, had a consultation with Jo to see if she could sort them out. And I'd also had a C-section when Alfie was born, so she said that she'd be able to laser that for me as well. And it's definitely taken away a lot of the redness in the scar in particular. It was very raised and now it's become quite flat. And my stretch marks have pretty much gone, so I'm delighted.
Treatment like stretch marks, cellulite, yeah, I'd definitely consider it like once I've had a baby, because you get back into the gym and things and those aren't going to go away from the gym. So yeah, cosmetic surgery's the only way, really.
Women are perhaps worried about having any sort of toxins or any products put into their body, maybe not long after they've had a baby.
With most treatments, you can usually have them after you've stopped breastfeeding. However, with some treatments, it's advisable, purely from an aesthetic point of view, to allow the body to recover for possibly 6 to 12 months.
When I came for my consultation, Alfie came along with me, so he got to see all the weird things that Mummy was going to have done to her. And yeah, they're really friendly, they're really welcoming, and I would definitely come back again to get something else done. I need to find something else that's wrong to get fixed so I can come back.
For acne, I would recommend laser, chemical peels, or the derma roller. Prices for those treatments vary from £300 to £500. The second treatment we discussed was pigmentation. Again, this would be using either the laser or the chemical peels. Prices for these treatments generally start around about £100 per treatment. And last but not least, we discussed stretch marks. The treatment I would recommend for stretch marks would be the derma roller, and treatments generally start around about £300.